Max Wardell over at athletics.com. I got a baseball player here. We're going to work on some medial elbow discomfort. We'll do a little bit of soft tissue work. This is more aggressive onto that pronator teres muscle and then FCU. Whenever I do this, I just start with a little functional massage. I kind of got him in semi-sideline where he's kind of rolled backwards, and I'm just doing a little pressure towards the origin here, and then I can lift and I can pull, so I can do a little lengthening away from the origin. Just a little functional massage, increase the blood flow. Sometimes this is uncomfortable. You got to grade your pressures based on the athlete you have. Use more diffuse contact. It's just kind of a pin and stretch, but then I'm also towards or away from the insertion. And I use different movements, so I'm actually incorporating a little valgus here. Not super acute. I don't use this post Tommy John, but I'm doing a little bit of valgus. I'm going supination to pronation, so I'm lengthening in supination with valgus a little bit, and then I can actually come to the UCL and do the same thing. So I'll start with some of that, and I actually like to go into some activation, like active release, where I get a little bit of, this is actually cocoa butter. It smells good, people like it, it works fairly well. So I get a little bit of that on there. I don't like a lot because you do want a tiny bit of grip. I'll kind of do some more diffuse contact towards that medial epicondyle. Just some massage here, then I'll kind of pull away. I'm using the hypothenar portion of my hand. And then this is often the most successful portion. So what I have Dom do is he's going to extend his elbow, and I'm going to use a dummy thumb technique, and he's going to nice and slow, and then while he's going with my presence on there. As he gets to full extension, I kind of let go, and you can really find where he's limited. But I always go into extension with this because I can kind of feel it as he extends his elbow, especially in that pronator teres. It's a bit tougher to do for FCU, but I'll spend 3-4 minutes. And then I'm going to have him do a ulnar and radial deviation. So I want you to do this, and I'll do this nice and slow, and I'll kind of strip the muscle a little bit with a dummy thumb. So I'm thumb, pressure on top, and I'm going origin to insertion a little slower for me down. Yep. And so I'm doing it during both eccentric and concentric here, mainly lengthening and shortening. And I can go the other way too, so a lot of times we use the other direction to increase blood flow. Generally the lengthening is more for like collagen fiber alignment, things like that. And I find that generally the lengthening gets a little bit better lasting effect in terms of decreasing symptoms. But I do both, and then I can actually go across the fiber. So why don't we go into that elbow extension again? So start a little more bent for me, and I'll start down here near the UCL, and I'll actually come up to the ventral elbow towards the cubital fossa, but on the medial side of the biceps tendon. So you can see I'm doing this right now as I come across, doing that, but I'm using, the pressure is coming from my other hand and I need to grade it. So I'm always looking at his face, asking him how he's doing. After I do a little bit more of the cross friction, I'll come back, and then I'll go maybe more in just the pure flexor tendons, and kind of, I'm not doing a lot of movement here. I'm holding it, and I'm letting him kind of do a little bit of a longitudinal but also a transfriction massage, because it's like a J hook, because he's moving and I'm not. And then I can do the same thing with a more diffuse contact. And here I do like to strip it a little bit. So I spend 10 minutes doing this. You don't want to spend too much time. especially if you've already done Graston or something like that. I like to follow it with this a little bit. And I find it to be extremely effective for someone that's got a little bit of discomfort towards the origin there on the medial epicondyle. So medial epicondylitis, they're throwing athletes, golfer's elbow. But I'm letting him up, and then as he extends, I'm coming down. So if I come from this angle, I'm going more in line with the fibers, which is sometimes very, very effective. But I want to grade my pressure. I don't want to crush him here. Sometimes you may want to get a little bit more aggressive, but in general, I want there to be force to where he can feel it, and you can kind of feel where it's uncomfortable, but the goal isn't to destroy him with this. And you don't need very much force at all to, go ahead, to make it an effective soft tissue mobilization, because he's lengthening the tissue at the same time. So this is some of our favorite stuff to do for that medial elbow. Incorporate your Graston, incorporate your functional massage, and some of the other things you're doing as well. But very, very good, especially when you can incorporate active movement of the patient. And having them close to a position where they will encounter that stress in the throw is very important too, because you can actually sometimes access different tissues based on whether they're in pronation, supination, up there at 90 degrees of shoulder elevation. So give that one a try. Let me know how it goes in the comments section. We'll see you in the next video.